A hemorrhagic stroke, in essence, is a bleeding in the brain. Morphologically, it looks like this. One of the small vessels, one of the arteries that was carrying blood to the brain, bursts. Bleeding occurs, but if the bleeding comes out, say, externally, we can see this blood. But here the bleeding is internal and intracerebral hemorrhage, or bleeding meaning a certain amount of blood is released inside the brain. Of course, the blood in the vessels is under a certain amount of pressure. This pressure is higher than the pressure in the nervous system, and therefore the blood pours into the nervous tissue, having a strong destructive effect on the nervous system and causing global damage to the nervous system with the significant impairment of vital human functions. That is, these brain hemorrhages, according to statistics, 80% of them end in death. In other words, a brain hemorrhage leads to death in a person. Obviously, there is massive destruction of the nervous system. Without the nervous system, without the head, without the brain, a person cannot exist, and most often they die. As for the remaining 20% who survive, they are left with a huge neurological deficit and significant changes remain. And usually these changes are difficult to correct. That is, while it is possible to achieve some degree of recovery after an ischemic stroke with a hemorrhagic stroke, this is practically impossible. And hemorrhagic strokes, unlike ischemic ones, are an extremely severe condition for the brain and for the body as a whole. Hemorrhagic strokes are classified according to the location where the bleeding occurs. There are three types of hemorrhagic stroke. If the bleeding happens in the parenchyma of the brain itself, as you can see here, this is called the parenchymal stroke. The blood has leaked into the area under the capsule. This area is located between the cortex and the deeper parts of the brainstem. As a result of such extensive bleeding, the temporal lobe, parietal lobe, and often the frontal lobe, as well as the neural pathways, are affected. In these cases, it is not the cortex of the brain itself that dies, but rather the neural pathways that pass through this area. This leads to significant impairment of neurological functions such as movement or sensation. And often this can result in compression of the central brain structures. Edema will develop there. There is always edema. And as the edema develops, it compresses the brainstem structures that are responsible for sustaining life. This immediately leads to disturbances in heart rhythm, blood pressure regulation, breathing, acid-base balance, and the functioning of the autonomic support for all internal organs. And this leads to global dysfunctions and is often exactly what can result in a person's death. This is parenchymal, meaning a hemorrhage into the actual structure of the brain itself. Often, the hemorrhage doesn't even occur within the brain structure itself. It can occur, well, I show on the scans what these hemorrhages look like. So, look, here, the entire frontal lobe, one half of it, well, that's it. Instead of this neural tissue, there's just a hemorrhage. It's simply blood that has poured out, and then the blood clot forms there. It appears very opaque on the X-ray, right here. And sometimes the blood spills into the ventricles. These are called intraventricular hemorrhages, or when blood breaks into the ventricles. The brain's ventricles are filled with cerebrospinal fluid, which cerebrospinal fluid provides nourishment to the central structures of our brain. And a hemorrhage into the ventricles leads to less damage to the neural tissue itself. Well, you might think it's just a ventricle. But usually this blood becomes a very strong irritant for the area where the ventricles are located, the central parts of our nervous system, which are responsible for the basic vital functions of the body. This includes breathing, autonomic functions, the regulation of the digestive system, autonomic regulation of the cardiovascular system, vascular tone, and various other functions of these subcortical structures that support the entire operation of our body. It's not even about what we feel or think. And ventricular hemorrhages lead to irritation of these central parts of the nervous system, and as a result, a person's ability to maintain vital bodily functions is disrupted. Therefore, statistically speaking, ventricular hemorrhages manifest with fewer neurological symptoms, but they result in a mortality rate of up to 95%. In other words, this is an extremely severe condition that simply shuts down the activity of the nervous system. And the third type is subarachnoid hemorrhage. This is also a hemorrhagic stroke subarachnoid when blood is released not into the nervous tissue itself, but into the area between the nervous tissue, between the brain and the skull. That's where the brain membranes are located. And in these membranes, cerebrospinal fluid also flows and circulates. Bleeding into that area leads to blood entering the cerebrospinal fluid into the subarachnoid space. And a subarachnoid hemorrhage will not necessarily present with severe symptoms of nervous system damage, although it is still an extremely serious condition causing meningeal syndrome, and essentially the brain becomes covered in blood from the outside, which of course disrupts its nourishment. Now, regarding the causes of hemorrhagic strokes. Well, look, a hemorrhagic stroke is when a blood vessel bursts. Why does a vessel burst? Wherever it bursts, that's where the stroke occurs, and that's how it's classified. It could be parenchymal, ventricular, or subarachnoid, but the reason for this most often, a vessel bursts because the blood pressure inside the vessels was critically high. This is either due to hypertension in general, which constantly causes elevated blood pressure, and the vessels are no longer young, they've already changed with age. There are certain changes in the thickness and strength of the vessel walls, and in such cases with prolonged, untreated, or poorly managed hypertension, these kinds of hemorrhages can occur. But more often, it's not the hypertension itself, but a hypertensive crisis. That is, against the background of more or less stable blood pressure, there is suddenly a sharp one-time spike in pressure with activation of the sympathetic nervous system, and this can cause just one strong surge in blood pressure and a small vessel bursts. Of course, very often hemorrhagic strokes occur in the presence of congenital or acquired or newly developed aneurysms in the blood vessels of the brain. What is an aneurysm? It's a dissection. An aneurysm is a dissection, meaning that the vessel wall has three layers: the outer, the inner, and the middle muscular layer. And what happened here is a kind of dissection of the vessel wall, and some sort of arteriovenous malformation formed the vascular bundle. And in this vascular bundle in the brain, well, the vessel wall there is weak, and this is the thinnest spot. This vascular bundle, the tricky thing is it might not show any symptoms at all while it's in the brain, but the vessel wall is thin, and with some kind of stress or increased blood pressure or nerve spasm, and it's right there that it starts to rupture well. There's a certain amount of blood even inside the vascular bundle itself. That's how this kind of hemorrhage occurs. Often it's a subarachnoid hemorrhage, specifically from these, but I think we'll dedicate a separate video to these aneurysms, these malformations, vascular formations that can cause such bleeding. Of course, trauma. The cause can be trauma of traumatic origin, some kind of blows. Well, in that case, while in the previous examples, it's mostly older people with trauma, it can happen at any age. And here, the connection between a brain hemorrhage and trauma is clear. You can directly link it to trauma, contusion, or a brain bruise. Often, systemic diseases such as diabetes, autoimmune diseases, and rheumatic conditions simply lead to blood vessels becoming thinner and more prone to rupture. And because of this, these causes can contribute to the development of such hemorrhages. So, how does it manifest? Essentially, like all cerebrovascular disorders, a hemorrhagic stroke presents with two types of symptoms: general cerebral and focal. The general cerebral syndrome will be the most pronounced. That is, headache up to loss of consciousness, impaired consciousness is less common, but loss of consciousness is more frequent. Severe disturbances occur due to brain swelling at the site where the hemorrhage develops there. Swelling will also occur. The swelling leads to increased intracranial pressure. This can trigger an epileptic syndrome when a person begins to experience convulsive activity. Seizures can lead to tonic and clonic seizures can even result in a person's death. In general, brain disturbances are accompanied by symptoms like vomiting, disruption of vascular tone, as I mentioned, breathing difficulties, and this is usually the most severe manifestation, and this is what becomes the cause of death. The lesions are focal but global. Usually it's the entire half of the head. Usually these are paresis, not just paresis, but paralysis. What's the difference? Paresis is a reduction in strength, whereas here the arm is completely paralyzed, the leg is completely paralyzed. With ischemic strokes, there is usually just a decrease in strength, but here the damage is global. And sometimes, even if the person survives, recovery does not occur. And the focal lesions can affect huge areas of the brain involving, well, practically the entire hemisphere. It is rare, very rare, for it to spread to both sides. Still, it is more typical for it to affect only one side. And with subarachnoid and intraventricular hemorrhages, meningeal syndrome is characteristic, as well as symptoms of damage to the membranes of the brain. And then there are also these symptoms of damage, such as rigidity, stiffness of the neck muscles, and the Kernig and Brudzinski signs, which we as neurologists identify. And these meningeal syndromes simply indicate that blood has leaked not only into the brain itself, but also into the cerebrospinal subarachnoid spaces. Diagnosis. Guys, it's all very simple. We see a person in extremely serious condition. We see that some kind of catastrophe has occurred in the head. We send the person for, well, in the past I used to send them for a CT scan, a computer tomography, but now it's MRI, but both are good. Even on a CT scan, which is essentially an advanced X-ray, we can see a massive accumulation of blood, a hemorrhage inside the brain. That's it. The diagnosis is easily confirmed. The diagnosis is confirmed with a high degree of certainty, but unfortunately, with such confirmed diagnosis, the prognosis is very, very poor. Well, I often had to see this recalling, let's say, my medical past, back when I still worked in the hospital. I remember those cases when I encountered hemorrhagic strokes. Well, from my experience, all hemorrhagic strokes, except for one case, ended in death. In other words, the damage to the nervous system is practically total. When a CT scan shows a hemorrhage the size of my fist, occupying 2/3 of a cerebral hemisphere, the damage to the nervous system is just enormous. Yet, at the same time, the person is still relatively young and still has a fairly healthy heart that keeps beating, the breathing is functioning, the digestive system, although under stress, is still working to some extent. And the damage to the nervous system, you could even say, is incompatible with life. And that's why ultimately the prognosis for such strokes, when we see on the CT scan a massive amount of nervous system damage, the prognosis is determined by the volume of nervous tissue affected by the hemorrhage. And most often, when the area of damage is large, the prognosis is extremely poor. Well, that's what relates directly to diagnosis. As for the diagnosis of subarachnoid hemorrhages, we perform a lumbar spinal puncture, enter the canal, and collect cerebrospinal fluid. Usually, the cerebrospinal fluid is under high pressure. That is an increase in intracranial pressure. The cerebrospinal fluid will come out under pressure, and there will be blood in the cerebrospinal fluid. There is blood in the cerebrospinal fluid. This means a subarachnoid hemorrhage. This is a huge problem because it also presents what's so bad about a subarachnoid hemorrhage. The blood that is present in these spaces acts as an irritant to the nervous system. And this irritation can lead to a reflex cessation of breathing and vascular tone in a person. That is, irritation of the cerebrospinal fluid spaces in the brain by blood can result in, as you see, a person's breathing and the vascular tone that maintains our blood pressure. These are regulated reflexively by the medulla oblongata. But here, the irritation of these structures by blood, the mere presence of blood, there causes everything to just shut down. And a person's automatic breathing simply stops. In other words, they stop breathing on their own. Of course, you can intubate them, start artificial ventilation, and support them mechanically, but the function of independent breathing ceases. Honestly, this is usually what people die from. And the same thing happens with vascular tone, because it is also maintained by the action of the medulla oblongata structures. These structures become irritated when blood is present in the subarachnoid space. All right, I realize that I might be stressing you out a bit, my students, overloading you with this frightening, serious information. I know that you're used to hearing lighter information from Dr. Golod, usually about milder illnesses that are easily treated with turmenium ceramics and a massage bed. But unfortunately, in our field and in urology, as well as in medicine in general, are conditions that cannot be cured with turmenium ceramics, situations that require resuscitation measures to preserve a person's life and provide assistance to maintain their vital functions. And so in the case of a hemorrhagic stroke, treatment primarily involves stabilizing vital functions, maintaining heart function, supporting vascular tone, and ensuring breathing if it is not occurring automatically, then providing respiratory support. Maintaining diuresis, that is, if the kidneys stop producing urine, then by any means necessary, stimulating diuresis. Stimulating the function that has stopped as a result of the hemorrhage in the brain. Of course, stopping the bleeding. This includes sodium gelatin, disinone, or any hemostatic drugs. Understand that if we have blood here with external bleeding, we can press on it, tie it off, bandage it, and we stop the outflow of blood. It's not always possible, of course. Surgical treatment can be performed, and sometimes it is. Sometimes the bleeding vascular malformation is removed, tied off, or sutured. Sometimes surgery is the method of treatment, yes, to tie off that bleeding vessel and achieve hemostasis. But no one has ever ruled out stopping the bleeding with medication either. Eliminating brain edema. Of course, there will be severe damage to the nervous system. It is immediately accompanied by swelling. Therefore, anti-edema measures are needed, such as diuretic medications, reducing cerebrospinal fluid pressure, for example, by performing a lumbar puncture. Sometimes it is performed for diagnostic purposes. Sometimes for therapeutic purpose to slightly reduce the pressure of the cerebrospinal fluid in the spinal canal and thereby slightly decrease the increase in intracranial pressure. Of course, normalization of blood pressure is also important. During the recovery period, various therapeutic physical exercises and procedures such as electroneuromuscular stimulation are performed to restore the functioning of the nervous system, although this mainly affects the peripheral nervous system. Trophic therapy is also used to improve the functioning of the brain itself. All of this is done, but the treatment of hemorrhagic stroke is an extremely challenging process. Here, the most important things are stabilizing vital functions, stopping the bleeding, and then focusing on recovery and further recovery. Well, today our video was a bit more serious and I'm sure more frightening. I think this is something we also needed to discuss together. Let me remind you, friends, that we are currently covering the topic of the neck, the blood supply to the brain, and disorders of cerebral blood supply. I think we'll talk separately in another video about these vascular malformations, vascular bundles, and vascular plexuses that form in the brain. What is it? How does it manifest itself? What to do with it? We'll also discuss chronic disorders of cerebral circulation, but not all in one video. I don't want to overload you with information. So friends, that's all for today.